Good afternoon, Chair McEwen and committee members. My name is Venessa Soldo-Jones. I've been a paramedic with Alina Health since 1997. I'm a retired firefighter for the city of Andover, and I've been an emergency department nurse at Coon Rapids, Minnesota at Mercy Hospital since 2008. Today I speak in favor of SF444, the HEAL Act. So there is a circulating rhetoric that if an inpatient nurse refuses to accept a patient into his or her safe assignment, then this causes other patients to have to wait longer in the emergency departments for an inpatient bed. It's being charged that these patients waiting longer in the emergency department will suffer harm. Nurses are being accused because of their laziness and unwillingness to accept these overtly heavy and unsafe inpatient assignments, that this is causing all of the backlogging across our emergency rooms. So let's dissect this straw man argument. Let's focus on the truth. The truth is, forcing nurses to increase their patient assignments, either through this benchmarking or adding additional patients, or by assigning highly acute patients in which one nurse is unable to safely care for, is the direct cause of patient harm. Truth, forcing nurses into these unsafe assignments is not the solution to decompress the emergency departments. Truth, supersaturating a nurse with more patients than what is deemed safe by evidence-based practice is not only unsafe, it is not a sustainable approach to safe, competent, comprehensive, and patient-centered care. So rather than blaming the care staff for advocating an unsafe and impossible logistical solution, why don't we start by asking the right questions? Why are hospitals not expanding their inpatient care capacity to meet the growing demands? We began asking this question during COVID, and not only did our questions fall on deaf ears, we watched while they closed St. Joe's Hospital. Since then, we watched as they continued to diminish and eliminate our services across all of our campuses. Patients today are getting older with healthcare needs requiring more nurse time to not only complete the task work, passing meds, performing assessments, and reevaluating for changing conditions, but to also meet their human need, which is getting people back to their best life. This is the expectation of the patient and the soul of nursing. We learn about the patient and their life, what is important to them, and how we can support them in their goals. This is human work. This is not an assembly line that makes widgets. Nurses are not refusing to care for patients. Nurses are refusing to provide unsafe care. And I think this bears repeating. We are not refusing to care for anyone. We are refusing to put you into a situation that is well documented to be on a fast track to harm. We are your voice. We are your advocate. And when a nurse sounds the alarm that something is unsafe, the proper response is to ask thoughtful questions with dialogue about cause and cure, not a barrage and an attack of shame and blame like is happening today. You, as healthcare persons yourself, you should be asking questions about who and how your loved ones will be cared for when the time comes, and it will. You should be wildly concerned about the landscape of healthcare today and where we are going, and we are asking for your support in this legislation so we can help the nurses who care for our most vulnerable, the sick, and the injured. Thank you.
Thank you for your testimony.